Sadiq Khan, consultant orthopedic surgeon practicing in South Mumbai. I'm attached to Apollo Spectra, Masina Hospital, and MS Abu Siddiq Hospital in Mumbai. I have been practicing since last 15 to 20 years, been very much in the trauma practice, but I am also interested in joint replacement and in sports surgery. Nowadays, the most of the things are coming up mostly in the trauma, between the high speed trauma we are getting nowadays, road traffic accident, as well as the domestic fall. So these are the various causes of the fracture the patients are affecting in various age group. Because the thing is that nowadays there are a lot of changes in atmosphere and surroundings. The people are getting a lot of traumatic injuries, including the ligament injury as well, and the periarticular and articular injuries in the fractures as well. So there is an increasing concern about the prevention of the trauma as well as the improved technology in treatment and the surgery of the trauma surgery in the fractures. So what are the causes of the trauma and the fracture? First is the road traffic accident, domestic fall, and the fall and the trauma and the fractures is coming up due to the sporting activities, including the children as well as the youngster playing the sports. These are the common causes. But there is an increasing trend in all the fractures and trauma, and the severity of the fractures we have seen last more than 3 decades. So you usually get a less and low speed energy trauma and fractures previously. Nowadays we are getting very high speed and very severe kind of the fractures, including the intra-articular. These are the common causes in age group and spectrum. And how can we can prevent? Basically, we are just talking about prevention first. Usually in our discussions, we take the prevention the last. But I usually very much inclined to focus on the preventions. One thing I forgot, in the old age group, we get the osteoporotic fractures as well. What are the prevention factors? That we have to increase our the bone health with the various calcium and vitamin A supplementation, as well as the various safety protocols. It is a different kind of the safety braces and all we can use whenever we are into that kind of an atmosphere. While at the field in the sports, we have to adopt the safety practices of the sports, and in a home we have to use the different kind of things to prevent the domestic fall. Basically, in old age group, we have to keep the room well lit throughout the night, because the old age has a very less vision. At the same time, then we should not be the slippery tiles around. At the same times, we have to keep all the bathrooms and the surrounding of the bathrooms very safe, like putting the hand barricades or lashes or different kind of wall attachment to has the whenever the patient falls, then he can catch up someone and just stop the fall. These are the prevention methods. What are the treatment? If the fracture is of the low speed trauma and domestic fall, there is not like an increase, very severe fractures like undisplaced fracture can be treated with the plaster. At the same time, a very minor hairline fracture can be treated with the rest, ice fomentation, elevation, and the rest for a few days. And other fractures like there is undisplaced complete fractures, they require something immobilization in the form of braces and plaster for 6 to 8 weeks. Sometimes some fractures are 4 to 6 weeks, depending on the fractures age group and the kind of the personality of the fractures. But if the severe fractures are there, definitely we need to operate. Okay, we need to operate in form of the surgery. We can put a plate, the screws, wires, and the rods at the same time. But how come we reduce the complication of the fractures? At the site of the fractures, we have to just concentrate on the first aid of treating the trauma patient, like transportation. So we have to brace the patient with that particular area of the fractures. We have to compress with some kind of bandages and compression bandage, some kind of the splints. There is a handy splints like wooden rock or some kind of cardboard, some kind of wire, steel wire that can support or steel like iron rod or something to just support the fracture site as soon as we want to shift the patient to the hospital, and that can be taken care of in the hospitals. So that's all for that one. And at the same time, our post surgery, we have different kind of procedure that we can discuss in other videos. Thank you very much.